Good morning, ma'am. Good morning, my dear friends. Uh, uh, Let me continue with the mental health assessment. Like we are discussing about case presentation and depression. So okay, we have completed history collection, then physical examination. The third part is mental health assessment. So what do you mean by mental health assessment? Under that, what are the things which are involved in the mental health assessment? So in that, first we'd like to know about the patient general health, okay, general appearance. Okay, first we should know the general appearance of the patients. General appearance, body build is the thin body build because he is only 58 kgs. Then his physical appearance is dull, and he's uncomfortable to the hospital environment, and his grooming also is not clean and clear. Then the self care also, there is a self care deficit due to depression. Then the facial expressions also sad and dull. Okay, then the next one is attitude towards the examiner. How his attitude towards the examiner? Okay, when either he is cooperative, either he is showing hostility, or either he is showing interest, or he is having any irritative behavior. So here, my patient, okay, my patient Mr. Raju he is not at all cooperated. He is not showing interest towards the when I'm asking the questions, when I'm collecting the history, he's not showing that much interest. Okay, he's always having the irritative behavior. Okay, then the comprehension of the patient is impaired partially. Okay, then the gait and posture, the always he feels to sit alone in the room. Okay, the motor activity, mostly the motor activity is decreased in the patient. Okay, then he feels restlessness. Okay, there will be a withdrawal syndrome, social withdrawal also is there in the patient. Okay, then the social manner and non-verbal behavior. The social manner, he is having a social isolation. He want to sit alone, like sleep alone, be alone. So he is having a social withdrawal. So non-verbal behavior also decreases, means he is not at all talking with the patient, he is not at all talking with the even family members. He is not at all having a good communication with the others also. Then the rapport is dull. Then the hallucinatory behavior is always he is having some sort of hallucinatory behaviors, he used to cry without any reason. Okay, he used to cry without any reason. Then the next one will, after general appearance, then we'll move on to the speech. Okay, how the patient speech, okay, how the speech, tone, volume, productivity, everything. Okay, here the rate and quantity of the speech, rate and how much he can, the quantity, how much amount of speech he can for a single topic. Okay, the rate also here, the patient is having, he is already depressed patient, so he have a slow pressure of speech. Okay, he have a slow pressure of speech. Then the volume and the tone of the speech, how the volume and the tone of the speech here, in the sense the volume and tone has been decreased. Okay, he had his speech of volume, speech of tone maybe might has decreased. Then the flow and rhythm of speech, how, while flow means while he is speaking, either he is having any thought block, or he is stopping any in between the conversation or not. Rhythm or flow of the speech is hesitated, because no, he cannot speak properly because he is a depression patient, so he is having a hesitated in the speech. So here you can identify the patients may have calm and he always wants to be in a calm and quiet environment. If you get any noises also, he is so much irritable. Okay, then the might be having the flight of ideas, right? Okay, the flight of ideas, or it may be tangentialities and all. Okay, here flight of ideas, in the sense sometimes the patients may have pressured speech. Okay, rapid fragmented thought manifested by the pressured speech. Okay, but here there is no tangentiality. He is having a good he is having hesitated speech. Okay, then the next one is mood and affect. In the under the mood and affect, okay, what do you mean by mood and what do you mean by affect? So speech in the sense, so we all know the speech, tone of the speech, rhythm of the speech, and productivity of the speech, flow of speech. Okay, we'll understand the all the, in that there will be circumstantiality, tangentiality, flight of ideas, thought blocking. There are the many things are there in the speech. Okay, so here what do you mean by mood and affect? Okay, what mood and affect in the sense, here what do you mean by affect? It is a feeling of tone and refers to the emotional state of an individual. Okay, it is a feeling of tone which is refers to the emotional state of the individual. What do you mean by mood here? Mood in the sense, it is a affect sustained for a long time is called mood. Affect sustained for a long time will called as mood. These two terms, mood and affect, the two terms are together, similar character. These two terms having a similar character, like how the weather and season occurs. Okay, how the weather and season, okay, like depends on, based on the season only the weather may be present, how whether the summer during of the summer season will feel hot, during of the winter season will feel cool. So like mood and affect also will have a similar characteristics. Okay, so here there are the abnormalities also we can find in the mood and affect. So for example, if I'll ask the patients to how you are feeling now, okay, if he gives appropriate answers, so we may say that yeah, he's having normal mood and affect. If he gives inappropriate or congruent or incongruent answers, okay, incongruent answers, that time we may say that the patient is having some sort of disturbances is mood and affect. Okay, what do you mean by congruent? Means if the mood is appropriate, okay, if the mood is appropriate we'll call as congruent. If the mood is inappropriate will call as incongruent. In the sense, like incongruent in the sense, see, sometimes the patients may feel happy when there is a sad event is going on. See, for example, there is a dead body in front of the person. If he is a normal person, what he will do? He will cry. But if there is a disturbances in the mood, he will laugh. Okay, like that we need to identify. Incongruent means they will feel happy when there is a sad event is going on. That is inappropriate mood. Appropriate mood means our normal human healthy beings used to have that appropriate mood. Okay, here my patient he is having appropriate mood. Okay, then the perception, next we'll move on to, that is comes under mood and affect. Then the next we'll move on to the perception. Okay, under the perception, whatever the things are present in the under perception, in the sense, first we should understand what do you mean by perception. Okay, perception is the meaningful organization of sensory data, okay, and their interpretation in the light of one's past experiences. Okay, perception in the sense, here the perception is, it is a meaningful organization. So for each and every individual, they need to have a perceive thoughts, perceive subject, perceive events, perceive situations. Okay, meaningful organization should have in our sensory data. Okay, that is comes under a perception. Okay, so here how the perception levels are there in the patient, doctor, Mr. Raju, how his perception levels are there in the Raju's. Okay, already he is a depressed patient, so he had a hallucination and he had perception, there are the disorders of perception is there, like sensory distortion and sensory deception and perceptual disturbances of time and space. There will be perceptual disturbances of body image. Here they have given hallucination, either the hallucinations are auditory hallucinations or olfactory, visual, gustatory or tactile hallucinations are there, or any illusions are there, or any depersonalization or derealization are there, any somatic passively phenomena is there, we should find out. So okay, so hallucination. So here what do you mean by hallucination? First you should know the what do you mean by hallucinations. Okay, hallucinations in the sense, it is a false perception of the like false perception which occurs in the absence of corresponding sensory stimuli. Here the false perception, the perceiver level will have a false, okay, false perception of absence of external stimuli, that is comes under hallucination. So the patient is having a hallucinatory like behavior, okay, the patient is having hallucinatory behavior. Mostly the patient is have auditory like auditory hallucinations, means if there is no sound but still he could feel there the sound is the sound is ringing in his ear, so he feels like that. So my patient is having auditory hallucinations, okay. Then the next one is illusions and misinterpretations, okay. Here comes, what do you mean by under perception only, what do you mean by illusions? Illusions is misperception of external stimuli, okay. Like I'll give the example for illusion. Misperception of external stimuli. See, by seeing a rope, okay, the illusion, if the patient is having illusion, he may say that is a snake, okay. If there is a rope, okay, the fading light a rope is misperceived by as a snake, okay, fading rope is misperceived by a snake. Here they'll by seeing the rope they perceives that is a snake, that is comes under misperception of external stimuli, that is comes under illusions, okay. Either patient is having illusions, means yeah, there is a illusions are there in the patient, okay. Then the depersonalization and derealization. What do you mean by depersonalization? Depersonalization means here the patient feels that there will be a sense of identity is altered, okay. The patient feels that here, if the patient is having depersonalization means he feels that he lost his identity, he feels that, or he feels that sense of identity is altered, means that may think that is unreal, okay. What do you mean by derealization? Here the derealization means the patient feels that environment has changed, okay, he feels that environment has changed, but that also unreal, that is not true, okay. So depersonalization and derealization. So here the patient, my patient have depersonalization, means he is feeling that he lost his identity due to depression. So because all the people are he feels that all people are avoiding me, I am not at all having any identity in the family, so he feels like that. So my patient is having depersonalization, okay. Then the next one is thought, okay. Here comes thought. The next one is thought, okay. Thought, what do you mean by thought here, okay. So thought, everybody will have a good thought process, right? See, if you are a normally healthy human being, will have a good thought, right? So when thought, we want to know about that in the mental status mental health assessment, in the sense like thought, there are sometimes the patients may have some disturbances in the thought, like there will be a stream and form of thought, like there will be a disturbances in the speech spontaneity, productivity, there will be a flight of ideas, there will be a poverty of speech, or content of speech, or continuity of thought. These are the things which may involved in the thought. But what do you mean by speech spontaneity? They'll give the answers while there is a conversation between each other, they'll use spontaneous speech. Then productivity, what do you mean by productivity? In the sense they are a product of the speech, okay, the volume of the speech will become good, okay. There will be there won't be alterations may occur, means like here the rate productivity means the volume or rate which thoughts are produced is altered sometimes, okay. So the productivity also means volume also sometimes might be altered. Then the flight of ideas, in the sense like they'll have they'll have some rapid or fragmented thoughts which is manifested by the pressured speech. Flight of ideas means they'll have pressured speech. Poverty of speech, in the sense like they'll have a poverty of ideas or content of speech. Or continuity of thought, in the sense like they'll have a, when they think, they'll have a continuation in their thinking capacity. Loosening of association means they'll have a disconnected thoughts, okay. Then the illogical thinking means they'll have a illogical ideas while thinking, okay. Then the preservation means they'll have a inability to respond, okay. They will have a inability to respond of the words, okay. That is comes under, or a repeated thought they may have, unwanted or repeated thought they may have, okay. Like inability, preservations means inability to respond, okay. inability to respond means they cannot give any responses when there is a conversation had been happening between each other, so they are unable to give feedback to the people. That is comes under preservation. Okay, then the what do you mean by verbageration in the sense they'll have a repetition of the words. Always they'll repeat when we'll have a conversation with the patient, so always they will repeat the same words. Okay, that is verbarization. Okay, then the content of the thought. What do you mean by content of the thought? Means the content, so which they thought in their mind, what the content which they will speak. No, see, if you have a idea in your mind only, you can speak properly. The volume, productivity, rate, rhythm, everything will be depends on completely your thought only. Okay, so here the content of the thought may be preoccupied. Okay, sometimes it may be preoccupied by the patients. Okay, because they may think that, so if they ask this question, so I supposed to answer like that. Okay, they'll have a sometimes preoccupied thoughts. Then so sometimes they'll have a obsessional thoughts means they'll have a unwanted thoughts or repeated thoughts. Okay, then so sometimes phobias, they may have a fear to speak. Okay, what to speak if they ask these questions, how I should answer, they'll have some type of phobias. Then the delusions also the patients may have, false beliefs. Delusions in the sense false beliefs they may have. Okay, these are the comes under thought. Okay, here what do you mean by, like, sometimes we can have thought blocking also. Thought blocking in the sense suddenly stopping a speech. Okay, when there is a conversation happening, so suddenly when the patient starts to speak, suddenly he stop his speaking, so that is thought blocking. They don't know what to speak, suddenly they'll stop their speech. That is thought blocking. Okay, so here to my patient what happened in the sense, in the thought he had a he had a flight of ideas, and he had a poverty of speech, and he had a loosening in the association. Sometimes there will be a disconnected of thoughts had been happened. Then he had a preservation in the sense he is not at all giving a proper response, inability to respond to the particular topic. Okay, he had some delusional effects, he had some phobias. Okay, these are the comes under thought. Next we'll move on to the cognition. Okay, here the cognition, how the cognition will depends. Okay, how the cognition will depend on the in mental health assessment. Like, cognition, here the patient is conscious. Okay, okay, the patient is conscious. Then the sometimes he is having confusion while giving answers. Then he is oriented to the time, he is oriented to the person, but he is not able to oriented to the place. Okay, then his attention. Okay, attention is like digit span test. Here in the under attention, see how we should identify the patient's attention. He is actively participating, or he is losing his attention. So we need to identify. How will identify in the sense, like, we'll give some digits. Okay, we'll give some digits, like digit forward and digit backward. See, for example, if I'll say the patients to tell from the number 1 to the number 100. So if he is having a good attention, so he may tell. If I'll say him to tell the backward, okay, from the 100 to the 1, sometimes he may lose his attention, means he cannot focus on the particular events. Okay, so sometimes he may lose. So here the attention in the sense we need to put some test, that is digit span test. So we'll have a digit forward and backward test. Okay, concentration. Okay, like the next cognition, under the cognition is concentration. Under concentration, the patients may have like subtract serial 7 from 100 or 3 from 40. Normally the sustained which may difficulty by to the patients, like here we need to give some months. Okay, for example, you think the months. Okay, there are the 12 months are there, from January to December. So we need to ask the patients to tell from the backward to the frontward. Okay, serial 7 from the 100 or 3 from 40, like that. Okay, Then the next, these cognition. So in under the cognition, my patient is conscious, sometimes he is having confusion, then he is oriented to the time and person, but sometimes he is losing his orientation to the place. And attention span is, he is telling forward digit test, he is getting good score in the forward digit test, but when I says him to talk about tell about the backward test, how he is failing to he is failing his attention. Okay, his concentration, in the sense like no, he's in these also his concentration is losing when I'm talking him to focus on 7 from 100 or 3 from 40. Okay, that is comes under cognition. The next one is memory. Okay, what do you mean by memory here? Okay, memory, cognition and memory. Okay, here we should know the memory. So memory, in the sense, see, for all the healthy individuals will have a good memory levels. Even some healthy individuals also, they will have a memory loss. Okay, sometimes no, will keep this is some object we may keep somewhere and we may search whole house. Okay, like that. No, sometimes we too have a memory loss. So what about the psychiatric patients? They'll have a complete memory. Sometimes they may have complete memory loss. Sometimes the memory may be memory may be altered. Okay, here the memory, there are the, why we need to check the memory, in the sense the patient's memory, how he is remembering, how far he is remembering. Okay, thereby we can identify how his memory levels are there in his mind. So here there are the immediate memory is there, recent memory is there, and remote memory is there. Immediate memory, in the sense the patient, how within the 24 hours what are the things are had been happened. Okay, if morning to till the night time, whatever the things are happening, if he remembers whole the topic, whole the content, so then his immediate memory is intact. But when we'll says that it is impaired, in the sense like when if I am, for example, if I ask the patients to what the breakfast you had in the morning, if he says that upma, if he really had upma, if he says upma, say it's okay, he had a intact memory. Okay, so for example, afternoon what you had, okay, then with which soap you used, okay, like that. So which color of dress you wear in the morning time, so like that. If we'll ask any like such type of questions within the 24 hours, whatever the things had been happened, if he says a correct answer, so his memory is intact. If he is not able to tell the correct answer, that memory may be impaired. So that is comes under immediate memory within 24 hours. Recent memory, in other sense, within the week. Okay, from the day of Monday to the day of Saturday. If I want to test the patients on the Sunday, okay, whatever the things had been happened from the Monday to the Saturday, whole week, the content, if he remembered everything, whatever the activities he did, with whom he has spoken, where he spoken, okay, where he slept, okay, how he slept, his which type of food he had, okay, like that. So if he remembers everything, okay, his memory may be intact. Okay, if he fails to answer at least in the one day, okay, or one thing also, his memory is impaired. Okay, like the next one is that is comes under within a week, recent memory. The remote memory, in the sense lifetime events. If I ask the patients when is your birth date, if he says that sir, this is the what 1996 or 1989, if he says and the date is March 5th, like that, with including date and time, the particular day, Sunday I born from my mother, and that is the what 4:15 p.m. a.m., like that. If you remember everything, so then when you started your schooling, when is your 10th certificate pass, date of this 10th certificate, when is your marriage day, okay, like that. If you, when is your daughter's birthday, when is your mother's birthday, okay, like that. Okay, if we'll ask any such type of lifetime completely from the birth to till a particular day, if I ask anything, if he is remembering and if he is telling the truth, real things, then his remote memory is intact. If he is failing to tell the answers, it may be impaired. Okay, here my patient is having immediate memory intact, but recent memory impaired, then even remote memory also impaired. Okay, because he is a depressed patient, so only immediate memory is intact in the here. Then we'll move on to the intelligence. Okay, what do you mean by intelligence here? Okay, what do you mean by intelligence? Intelligence in the sense, like no, the patient like no, who is having like IQ levels, who is having good IQ levels. Okay, there we'll call him as like intelligence power. Okay, here like what do you mean by what, how can will ask the patients in the intelligence means, like no, sometimes the patients, why we need to talk about intelligence in the mental status exam, mental health assessment, in the sense like no, sometimes the patients may lose his intelligence, sometimes he may be mental retarded, so subnormal levels may be intellectual functioning of subnormal level of intellectual functioning may be impaired. So that is the what we need to even assess the intelligence level of the patient. Okay, here the intelligence levels, sometimes the mental retardation, like it may be mild mental retardation, moderate, severe, profound. So these are the types of mental retardations we can find in the patient. Okay, here my patient is having mild retardation, means mildly he is not at all remembering the things, his IQ levels are mildly disturbed. Okay, then the next one is abstract thinking. Okay, here what do you mean by abstract thinking? Abstract thinking in the sense like no, here the patient, okay, he's so here the abstract thinking in the sense ability to deal with the concepts. Okay, ability to deal with the concepts in the sense appropriateness of the answers which they gave, which they given. Okay, means like no, here the patients may have abstract thinking in the sense ability to deal with the concepts. Like no, here what will happen means like the patient, okay, the patient who is having these, if he have a good abstractive thinking, he will give appropriateness of answers which we have posed. Okay, if a nurse posed a questions, if he is giving appropriate answers for the questions, or if he is giving good response to that questions, okay, then we may say that he is having a abstracting intact of abstractive thinking. If he is not able to answer, okay, if he is not able to answer, okay, then we may say that there will be impairment in his abstract, or there will be a disability of the abstract maybe thing. So there are they given the some test. Okay, they given two tests in the abstract thinking, like proverb test as well as the similarity or dissimilarity test. Okay, here what do you mean by proverb testing? Proverb testing in the sense this is comes under abstract thinking. Proverb testing in the sense here what they will do means like no, here they'll based on the socio-cultural or based on the educational background, the proverb testing can be done. Okay, based on the socio-cultural, based on the like background of the educational background of the patients, will pose some questions. So here will the patient for the to the patients, here the nurse can give three proverbs should be given. So three proverbs should be given to the patient in the proverb test. Then we need to read each proverb which is written. Okay, first we need, it should not be in a paragraph way. Proverb test means this is only based on the socio cultural background as well as the educational background. So this test, how we will do the test means we need to give three proverbs to the patient, but he is supposed to write it on the paper, whichever the words we are giving to the patients, he is supposed to write the relevant answers, okay, on the paper. Okay, as a nurse we need to read in front of the patient. Okay, then that word should not be in a paragraph wise. Okay, sentence, it should not be in a paragraph wise. If he wrote whichever the questions, whichever the words I have proverbs I given, if he wrote a relevant answers for that, he is having a good abstractive thinking. If he fails to write, the similar answers, then he may fail, he may have a disability or disturbances in the abstract thinking. Then the similarity and dissimilarity, here the similarity and in the sense like we should explain the basic similarities. Like no, here we need to what we have to do means like no, we need to ask the patients to, we need to ask the patient like two different object or situations. Okay, we need to ask the patients, to tell about the similarities of two different objects, or tell the similarity of two different situations. Okay, here we'll take the object, here we'll take some example for similarities or dissimilarities. See, for example, if I say the patient to tell similarities about similarities about potato and cauliflower. Okay, if I ask the patients to talk about the similarities of potato and cauliflower, if depends on the patient's answer only, we need to give some scores. Okay, based on the patient's answer, we need to give some scores. Here, if the patient says that, yeah, the potato and cauliflower is vegetables, okay, yeah, we can eat the both. And if he says that used to form in under the ground, okay, if says the relevant answers, okay, similar answers for these both, okay, we need to give good score. Means we says that he is having a good abstracting thinking. If he fails to tell the similar answers, then we can say that he is having a impairment in his abstract thinking. Okay, my patient is having he is having impairment in the abstract thinking because he is a depression patient, so he had a abstract thinking in the patient. Okay, the next one is insight. Okay, what do you mean by insight here? Okay, insight in the sense like is insight in the sense he is having a degree, so degree of awareness of problems and causes. Okay, here intact in the insight in the sense here the patients need to have a degree of awareness of his problems as well as the causes. Okay, he is supposed to know in which problem he is suffering from, and which signs of symptoms he is showing, and what are the causative or what are the treatment modalities is going on. So everything, if he having any if he is aware of these all the situations, or if he is having about his health problem, if he is having about awareness of his causes or awareness of problems, then we can say that he is having a intact insight. If he is failed to recognize his own problems, if he fails to recognize his own health status, if he fails to recognize his mental illness, then he will have a impaired insight. So here my patient is having depend on the patient's level of consciousness, depends on the patient's insight level. We need to give some grades: grade 1, grade 2, grade 3, grade 4, grade 5, grade 6. Okay, like that we need to give some grades. Okay, degrees. Okay, depends on the patient's depends on the patient's problem. Okay, depends on the patient's awareness. Okay, here my patient is having a grade 2 degree. Okay, then because sometimes he is not at all recognizing what the problem is happening to him, he is not at all aware of his causative problem. Okay, then the next one is judgment. What do you mean by judgment? Okay, judgment is the usually it's supposed to intact. Okay, so sometimes what will happen, there will be impairment maybe occur in the judgments due to any organic conditions, due to any psychosis, there may be impairment may occur in the judgment. Okay, actually the judgment, why we need to have a judgment in the sense why we need to have a judgment in the sense we need to have a problem solving and decisional ability. So all the patients, okay, who is having for all the healthy normal individual will have a decision makings, right? If there is a problem occurs, we can we should know the how we can solve the particular problem, and whenever the critical situations are going on, we should know the how to take a decisions. Okay, like that. So everybody should have a judgment in their own. So here also sometimes for psychiatric patients there will be a impairment of the judgment, they lose their judgment. So here by doing some tests and all, so we can see the either the patient is having a good impairment of judgment or intact of judgment. Here for my patient there will be impairment in his judgment. Okay, then the next one is after the judgment, then we'll move on to the investigations. Okay, here actually the summary, we have discussed about health history of the patient, then the introduction of the patient, and actually this is case presentation on depression. Under this we have seen history collection of the patients and introduction of the patient and profile, patient profile, all the chief complaints, present, past, medical and surgical history, psychiatric history, and family history, all the personal history, and all the biographic data we have seen, and physical examination and mental health status examination also we have seen. Next we will move on to the investigations. What are the investigations has been done to the patient? Okay, here to my patient. They have the first the name of the investigations, they have did complete blood test like RBC, WBC and platelet count. So here my patient value, actually the normal level of RBC for the male patients is 13 to 18 milligrams per day. So here my patients RBC levels are like 12. Okay, then the WBC count is actually 4,000 to like 11,000 should be there, but here the my patient's RBC level is 5,000 like WBC. Then platelet should be 1,50,000 to 4,50,000. So here the my patients are having 2,40,000. So then we need to check out all the serum electrolytes, and the serum electrolytes also normally we should have a like serum, potassium and all. Why means sometimes there will be a fluid deficiency may occurs. Okay, so that time, so if the patient is having depression, he cannot take proper diet also, fluid intake and proper maintenance of diet also, maybe they cannot take. So that is the way we need to check even serum electrolytes levels also. Okay, so here the 134 to 145 milliequivalents for the liters is the sodium serum sodium levels. So my patient is having like 124 milliequivalents per liter. So other than this, other investigations they have done like CT scan and MRI also they did. The CT scan and MRI, actually there will be a mild alterations had happened. Then ECG, if there is sometimes the patient is having heart problems, we need to go for ECG also. And EGG, electroencephalogram also they have did. And these are the investigations they have did for my patient. So remarks, so as knowing these all the alterations in the CT scan and alterations in the MRI and EEG, so they have diagnosed as impression is a depression. Okay, then we'll go on to the medication. So what are the medications they were using? Okay, what are the medications they were using for the patient? Okay, here they were using some of the medications like you all know antidepressants medications, right? Antidepressants like tricyclic and other tricyclic antidepressants, and then we'll see the serum serum receptors reuptake inhibitors, right? Okay, here they will use some medications. Okay, medications like tricyclic antidepressants, in that they were using imipramine and clomipramine. Okay, these two drugs they were using. Actually these dosage is 75 to 30 mg per day. Okay, orally they are using. Okay, the frequency is 3 times per day in a divided doses. Okay, these what is the what is the action of these tricyclic antidepressants, in the sense like not only the tricyclic, other drugs also they are using, like selective serotonin reuptake inhibitors. Under that they are using sertraline. Okay, sertraline and fluoxetine. Okay, sertraline and fluoxetine also they are using. The dosage is fluoxetine is 50 to 200 mg, right? Okay, sertraline is 50 to 200 mg. The in 3 divided doses, morning, afternoon. It's OD, like the TID. Okay, thrice in a day they are giving orally. The dosage the frequency, the route is oral route. Okay, so the action, okay, these are the two antidepressants at presently they were using. So these what is the action of these means, actually like in the depression what will happen? So mechanism of action of these drugs. Okay, when the patients take these type of drugs, what will happen to the patients inside his brain? Actually depression means there will be alterations occur in the brain, right? So what will happen when the patients takes these drugs? Okay, these directly affect on the neurotransmitters like serotonin and dopamine and adrenal epinephrine and norepinephrine. Catecholamines are presented in our brain, right? So there will be directly these medications affects on the catecholamines, serotonin and dopamine. Serotonin and dopamine. Why it affects on the neurotransmitters means, when the patient is suffering from the depression, they'll have a decreased serotonin levels. Okay, there will be a decreased serotonin levels in the brain, central nervous system. That is the way when the patient takes these type of medications, either tricyclic antidepressants, either the patient takes the selective serotonin reuptake inhibitors also. When he takes these type of drugs, so automatically it will increases the serotonin serotonin or dopamine levels in the brain. When it increases the serotonin dopamine levels, automatically the patients may have decreased depression level. Okay, that is comes under action. Then we'll move on to the side effects. What are the side effects we can see in the patients after taking these medications? Means he may have restlessness, he may have insomnia, he may have unsteadiness, and he may have nausea, vomiting, irritable constipation, anxious, confused, and stomach problems. Okay, generalized pain he may have, like these are the problems he may have, these are the side effects he may have. Okay, then what are the contraindications? Okay, when, in which areas we are a patient not supposed to take for depression antidepressants medications? Means when the patient is having bleeding disorders, it may be hemophilia. Okay, if the patient is having diabetes mellitus, or if the patient is a pregnancy, or if the patient is on breastfeeding. Okay, breastfeeding mother, pregnant mother, and diabetes mellitus patients or bleeding disorder patients is not supposed to take these type of medications. Okay, what is the nurse's responsibility in the sense? As a nurse, what we need to do for while providing, while giving, while administering the antidepressants? Means always we should warn the patient while taking these medications, like there will be a danger of ingesting of the food. Okay, thiramine. So when he is taking, he is supposed to avoid all the thiramine rich foods. Okay, what are the thiramine rich foods? Means there may be a beef liver, chicken liver, fermented sausage, or dry fish, or over ripened fruits, or chocolates, beverages like wine, beer, and coffee. These are the thiramine rich foods. Okay, when the patient is on antidepressant drugs, he is not supposed to take these type of foods, because there will be a danger danger of ingesting, there will be a danger may occur to the patient's body. Okay, that is the way we need to warn the patient not to take these thiramine rich foods. Okay, that is one responsibility. Then we need to report the patient when there will be headache or nausea, vomiting, any chest pain. If the patient is suffering with these type of symptoms, okay, we need to advise the patients to report immediately. Then we need to instruct the patient not to take any medication without prescription. Over the counter the medications the patient is not supposed to take. And we need to change the patient position slowly we need to change the patient position, because sometimes they may have orthostatic hypotension. Okay, we need to monitor all the vital signs strictly, and we need to, even blood investigations also we need to monitor, and we need to record on the patient case sheet. Okay, that is the comes under like medication process. Okay, then the process recording and review of related system here, in the sense like review of related system here, anatomy and physiology, central nervous system only. So because this is affected to the nervous system, okay, neurotransmitters, okay, there will be a decreased level of serotonin neurotransmitters, there will be depressions may occur. So it may be related to this review of related system is central nervous system. Okay, then the knowledge of the disease condition. Okay, first we'll see the knowledge of the disease condition here. How can, so what is the actually, what is the meaning of the, what is the antidepressants? Okay, how far it may affect to the patient? Okay, the first we will see the depression. Okay, condition, disease condition of the patient, that is depression. So okay, depression, it is a widespread mental health problem which affect many people. Okay, the lifetime risk of depression in males is 8 to 12%. Okay, there is a chances of getting 8 to 12%, and the females is, okay, in the females is 20 to 26%. Okay, actually the depression occurs twice as frequently in women as in men. Okay, the highest incidence of depressive symptoms has been indicated in individuals without a close interpersonal relationship and persons who are divorced or separated. Okay, highest incidence we have seen those who are divorced, or those who are separated, or those who don't have a close interpersonal relationship with the others. So there will be a chances of getting depression. Okay, depression is one of the leading cause of disability across the world. The World Organization in 2016 they estimated that depression is the depression will rank second only to heart diseases by 2020 in terms of globally disability. So as estimated, 3 to 4% of Indians, 10 crore plus population suffers from major mental disorders. In that, about 7 to 10% of population are suffering from minor depression. Okay, under 1000 crore of population, the 7 to 10% of population are suffering from the minor depression. Okay, Then the classification, under the classification, so like there will be mild depression, moderate depression, severe depression, and atypical depression, unspecified depression, recurrent depression. According to ICD criteria, there are the different types of or classification of depressions we can see. Okay. And the next one is what is the psychopathology. Okay, psychopathology here in the sense how it will occurs to the patients, what are the changes may occur in the brain, what will happen in psychopathology. For all the affective disorders, okay, for all the affective disorders can most easily be described by reference to the similarity of abnormal affect with normal emotions. So here what will happen means, first there will be abnormal will be affect to the normal emotions. Okay, first there will be abnormality may affect to the normal emotional level. So when there is a abnormal effect to the normal emotions of the level, automatically the patient feels that he may have a sadness deepens. Okay, then he may have a difficulty in concentration. And see, first there will be a abnormality. Okay, there will be a abnormal effect due to any abnormal effect. Okay, if there is a abnormality effect which leads to, there will be a effect in the emotional status. Okay, where there is a abnormality effect to the emotional status, what will happen, automatically the patients, if the, because there will be emotional is affecting, right, emotionally they were disturbing due to effects, due to any etiological factors. It may be divorced, it may be separated, or it may be loved one, loss of loved one. Okay, it may be any brain damages, or it may be organic brain tumor or somewhat. Okay, due to etiological factors, what will happen, there will be a abnormality may be affected. When abnormality affected, which leads to, there will be a disturbances in the emotions. When there is a disturbances occurs in the emotions, what will happen, directly it may be the patients may have a sadness in his, sadness become deepens. Okay, deep sadness he may suffer, and which leads to difficulty in concentration. Okay, he may have difficulty in concentration, and which leads to retardation of all thought and action. Okay, so first there will be a disturbances due to ethological factors, then there will be a sadness deepens, and there may be a difficulty in concentration, there will be a retardation of all thought and action. So the patients may have depression symptoms. Okay, that is comes under psychopathology. Okay, then we'll move on to the clinical features. What are the clinical features means, the patients may have like sadness of mood, like loss of pleasure, then loss of activities, and he may have hopelessness, feeling of hopelessness and worthlessness, and unreasonable guilt or self blame, and he may have suicidal thoughts, and he may have sometimes psychomotor retardation. Okay, like motor activity, and he may have anxiety, he may have restlessness, he may have feeling of uneasiness, and sometimes he may have psychotic features like delusions, hallucinations, illusions and all. Okay, okay, these are the things. Sometimes they may have difficulty in thinking and concentration, sometimes they may have a poor memory. Okay, sometimes they may have menstrual and sexual disturbances also. Okay, sometimes he may feel fatigue, aching, discomfort, constipation and all. Okay, these are the symptoms the patient, depression patients may show. What are the diagnostic studies, how we can diagnose these condition means, the patients may should go for psychological test. Like first they supposed to go for history and physical examination, then they go for psychological test. That Beck depression inventory is there, then dextromethasone suppression test also is there, and toxicology screening test also there. Like based on the ICD-10 criteria also we can identify which type of depression the patient is suffering, either mild, severe, moderate and all. Okay, what are the treatment modalities we can provide to the patients? Here we can provide psychopharmacology. Pharmacologic antidepressants are like selective serotonin reuptake inhibitors like citalopram and fluoxetine and sertraline, and tricyclic antidepressants like amitriptyline and clomipramine and imipramine and doxepin, then monoamino oxidase inhibitors. Okay, under we can see isocarboxy and phenalzine, and other newer antidepressants drugs also they have given, that bupropion and maprotilin. Okay, then other than the psychopharmacology we can provide physical therapies also. What are the physical therapies we can provide means, even ECT we can provide, even light therapy we can provide, and we can provide repetitive transcranial magnetic stimulation therapy also we can provide. So So the next one is psychosocial treatment. What is the psychosocial treatment we can provide to the patient? Depression patient means like psychotherapy, cognitive therapy, supportive psychotherapy, group therapy, family therapy, and behavioral therapy. These are the therapies also we can provide to the patient. Okay. The next diet plan, in the sense like dietary after knowledge of the disease condition, then list of nursing diagnosis. What are the nursing diagnoses we can plan for the depression patients? Means the first nursing diagnosis is there is a high risk of self-directed violence related to depressed mood, feeling of worthlessness, and anger directed inward on the self. Okay. The next diagnosis is there will be a dysfunctional grieving related to the real and or perceived loss, so as evidenced by the inappropriate expression of anger. Okay. The next diagnosis is powerlessness related to dysfunctional grieving process. Okay, as evidenced by lack of fulfilling the needs. Okay. The next one is self esteem disturbances related to helplessness and impaired cognition, as evidenced by the expression of worthlessness or sensitivity to criticism. The next fifth nursing diagnosis is there will be a impaired communication process related to depressive cognitions, as evidenced by being unable to interact with others or social withdrawal. The next nursing diagnosis is there is a impaired or imbalanced nutrition less than body requirement related to depressed mood or lack of appetite, as evidenced by the decreased body weight. Okay. These are the nursing diagnosis we can find in the depression patient. Okay. Then